Recording. So Lisa is a postdoctoral researcher with us here in the HRB Primary Care Clinical Trials Network, and she's working on the MyComReach project, which is a cross-border trial looking at medication review in multimorbidity. And she's actually from Galway. So she did her PhD in health psychology here before she went to the West Virginia University in the United States, where she coordinated a study to develop a new education tool to prompt young people and their families as they make asthma management decisions. And that's what she's here to talk to us today about. So I'll hand over to you, Lisa.
Indeed. So just adding my thanks to you all for being here this afternoon. I hope it's as beautiful wherever you are as it is here in Galway. Super. So yes, as Nikita said, we're going to talk a little bit about asthma action plans or asthma management plans today. So just a little bit of an overview of the plan for the 30 minutes. I'll start by talking a little bit about asthma action plans or asthma management plans. Touch on some information like the prevalence of asthma in Ireland and some barriers, according to the literature, to symptom control in asthma. I'll bring up some interesting stuff that I can find about asthma management in Irish primary care, kind of to provide a context for the main focus this afternoon, which is to talk about the study that Nikita mentioned that I was involved in for the last 2 years, 2016 to 2018 in West Virginia University, and that's called the Take Action Asthma Control study. And then talk a little bit about, or take an opportunity, I suppose, to reflect a little bit on asthma management in your own practice, if that's something that's relevant and interesting for you. And I have some resources to share there then. So as I said, the kind of, I suppose, core of the presentation is going to be on the Take Action Asthma Control study. I'll give you more information on that a little bit later. But just to, I suppose, declare myself, I am a health psychologist, and so my approach to all of this is in relation to the behavioural side. So the kind of approaches that healthcare providers might take to working with people or families when it comes to managing a long-term condition, the approaches that individuals themselves take to self-management and understanding health and illness, and then the kind of psychological tools that we can bring to support. In addition, the Take Action Asthma Control study was for children and young people, so my knowledge of asthma is really to do with paediatric populations and families. So before we kind of really get into it, I suppose I'm not totally sure on everybody's background, so this might be relevant or not to everybody, but if it is, and you're working maybe in general practice yourself, for example, maybe have a moment to think about how often you're seeing children, adolescents and adults with asthma in your daily practice. Ask yourself, what are the main issues that they face, maybe in general, but I suppose in particular in relation to their asthma. When you think about the people that you work with who are living with asthma, what are your main concerns for them and for the service that you provide in general practice? And then do you yourself give your patients who are living with asthma an asthma action plan? Is that something that's part of the way that you approach asthma management, or are you aware of people that you work with having their own asthma action plan? Maybe ask yourself why or why not that these asthma action plans might or might not be part of your practice. So that's just by way of kind of getting you in the mind frame for this discussion. So what is an asthma action plan? Might be a good place to start. So asthma action plans are a set of instructions that are related to asthma symptoms to guide people to make decisions about their asthma management on a daily basis or in response to symptoms. So they're generally arranged in 3 sections, although they can get very complicated or can be quite simple. There are many examples out there of asthma action plans. So in these two examples here that I've included, these are just two of many. On the left, you'll see the Asthma Society of Ireland Asthma Action Plan, which you can download for free from their website. And that one actually begins, it's kind of like the leaflet, it begins with another page ahead of what you see here on the left, that provides more information that the person can fill in relation to their asthma and know, in terms of knowing what to do in different situations, like how to get help. And then on the right, from the US, the National Heart, Lung and Blood Institute Asthma Action Plan. So these are two nice examples because one of them happens to be arranged in a vertical kind of layout, and the other is horizontal. You can see that there's varying amount of text. You can see they've used the traffic light setup, green, orange or yellow and red zones, and those are to correspond with day-to-day management. So in the green zone, if you don't have any symptoms, how to kind of keep on top of your asthma, taking your everyday medicines. The orange or yellow zones then are for responding to kind of some asthma symptoms, and then in the red zone then what to do if you were really in danger and really experiencing very severe asthma symptoms. So there's a lot of if-then type rules or instructions when it comes to managing asthma, and those are the kinds of instructions that people living with a condition can really struggle to understand, to kind of get them all in line when instructions can get quite complicated, which is very much the case in the context of asthma. Asthma action plans are part of most or all guidelines out there for the management of asthma, Irish guidelines, US guidelines, international guidelines. And there is evidence to suggest that they do effectively support asthma self-management and the reduction of symptoms associated with asthma. It's a very timely moment to be talking about asthma action plans here in Ireland because last week, you may be aware, was Asthma Awareness Week in Ireland. So this image here on the left is taken from the Asthma Society of Ireland website, kind of, I suppose, publicising Asthma Awareness Week. And there was very interesting information, such as the information there on the right, reminding us that one person in Ireland dies every 5 days as a result of asthma. That was really significant and surprising. But the big, I suppose, kind of action during Asthma Awareness Week that you can see here as being advertised is to do with asthma action plans. But interestingly, and this might be something that you are aware of or not, or that you can relate to or not, the use of asthma action plans is actually a bit more complicated. So two relatively recent studies, one from 2016 and one from 2019, really brings home to us that in this research at least, there is really low rates of use of asthma action plans. So the first study there was a large Canadian audit of 3 recommended primary care adult asthma management practices, including the provision of asthma action plans, and of 884 patients living with asthma and 4,199 visits, no asthma action plans were delivered, despite it being recommended part of asthma management. And then the Yawn et al. Study 2016, and this was in children, teenagers and adults in primary care in the US. It was found that guideline adherence was highest. So this was an assessment of adherence to guidelines. And guideline adherence was highest for the prescription of medications. You can see pretty high levels there, but lowest for the provision of asthma action plans, 3.1%. So I think we're really quite stark findings there in terms of the use of asthma action plans, which I think tells us something about how useful people perceive them to be, or something. What that is, I'm not entirely sure, but there's definitely something going on in relation to asthma action plans. And then I'm not sure in the Irish context, because my work in asthma action plans has been in the US, what the story is. So it would be great to learn from any of you working in primary care what's going on there from your perspective. So some of the things that might be behind this level of use of asthma action plans from the perspective of the provision of asthma action plans in a clinical setting, as well as the actual use of asthma action plans by a person with asthma themselves. The literature suggests that things like health literacy levels, so people's ability to look at a piece of health-related information and use it and understand it and comprehend it. Those levels of health literacy may be an issue. The confidence that people have, even if they are given an asthma action plan, has been reported as being a potential barrier to the use of asthma action plans. And then levels of asthma education, which have been found to not always be sufficient, may also act as a barrier to the use of asthma action plans. It's also been reported that if, say, a healthcare provider is working with a family or a person and feels themselves that they're not going to be interested in an asthma action plan, or they may not understand it, and they may make the decision themselves not to offer it at all. So there's a lot of things going on, it seems. Then in the Irish context, so as you know, asthma is a chronic inflammatory condition that can't be cured or prevented, but effective control is possible. And what is possible, and what is, I suppose, the aim, is that people living with asthma are experiencing symptoms rarely, and severe exacerbations also very little. Asthma in Ireland is characterised by a very high prevalence. It's the 4th highest prevalence of asthma in the world. It's also characterised by suboptimal control, a low uptake of lung function testing, low use of asthma management plans, and poor education of people with asthma in relation to asthma and its management. According to the literature, there is very mixed rates out there in terms of consistently engaging in asthma self-management kind of as it's prescribed. It's a real challenge to engage in asthma self-management on a daily and frequent basis, and some of the barriers reported include overestimation of control, so people kind of feel like they're doing okay with their asthma, so they don't need to change anything in terms of their management approach. They might be concerned about medications. In the case of asthma, some of the medications are steroid-based, and people have different beliefs about those. People often adapt their treatment based on their symptoms, so they might be feeling okay, and so they might start to use their inhaler a little bit less. They may have low kind of belief in terms of what they can achieve in their asthma control, and that can be very demotivating. And then asthma treatment knowledge has been found to be pretty low, and possibly a barrier to consistent self-management. And you can see there that adherence rates in one study varied from 49 to 71%, and that seems to be pretty common across the asthma literature. And so again, just bringing your attention to the fact that this is really children and adolescent focused. So as a result of these barriers, it's been found that asthma morbidity, including school and work absences, asthma attacks and mortality really do still persist. And an interesting point is that it's been found that children do actually have quite a high level of responsibility for their asthma self-management. So children as young as 9 might have kind of really be in charge of the taking of their inhaler every day, but also be not have maybe received kind of very personalised and appropriate guidance directed at them personally to make sure that they understand their asthma, so that they can take on this level of responsibility. Again, in an Irish context, and I'm really just getting into this asthma information in an Irish context, I suppose the approach to asthma management is guided by the National Clinical Programme for Asthma, which is the HSE initiative, and the aims of the programme are to maximise health and quality of life of people with asthma and prevent avoidable mortality due to asthma. And the objectives of the programme, and this is all from the HSE website, the asthma section, which is a wealth of information. The objectives relate to the access to integrated care and education, access to adequate support to achieve control of asthma symptoms, the provision of evidence-based care and services, partnership between the different stakeholders to support implementation of the programme, and identifying useful resources for the implementation of the programme. A major element in terms of the provision of or the achievement of the programme is this really excellent document the Asthma Control and General Practice Guidelines, which is based on international guidelines for asthma management called the GINA Global Strategy. The aim of this document is to provide assistance to improve diagnosis, monitoring and treatment, develop an asthma management plan for every patient, optimize asthma control and manage exacerbations in line with approved protocols. So just underlining the fact that developing an asthma management plan for every patient is a cornerstone of what we're hoping to do as part of really excellent asthma support, asthma management in Ireland. According to this document, the recommendations for asthma management contains 4 interrelated components: developing doctor-patient partnership, identifying and reducing exposure to risk factors, assessing, treating and monitoring asthma, and managing asthma exacerbations. Within that first one, the developing doctor-patient partnership, a written asthma action plan is seen as an essential feature for achieving what's labelled as guided self-management of asthma. And guided self-management of asthma has been shown to reduce asthma morbidity in children and adults. So supporting people to be in a position to be able to manage their condition themselves within their own lives and lifestyle is shown to have important positive impacts on asthma outcomes. So then moving on to the Take Action for Asthma Control study, which, as I said, is kind of the main focus today. And this is the study that I was involved in for 2 years at West Virginia University under the supervision of Dr. Christina Duncan, who's pictured here. And Christina is a paediatric psychologist who does a lot of work in asthma self-management support, and also in self-management support for young people with cystic fibrosis. So, the Take Action for Asthma Control study was a 2-phase study which aimed to first develop a pictorial asthma action plan tool and also then pilot test or kind of do a practice study of this pictorial tool to see if there was any added benefit or if it was at least as good as a kind of traditional written asthma action plan tool in supporting young people with asthma and their families. So we have already had to look at what an asthma action plan is, and I know that there's probably varying levels of experience with them kind of on the webinar today. And we've touched on the fact that they are evidence-based in terms of being an effective self-management support tool in asthma, but that there are definite issues going on out there in terms of their use. So among the aims of the Take Action for Asthma Control study, or the TAC study, were to address some of the barriers to the successful use of asthma action plans in clinical practice, as well as in kind of day-to-day life for people and families living with asthma. So some of the issues with asthma action plans are that they are quite wordy. They're written to a pretty high level in terms of readability. So about a first to third year in secondary school reading level is the norm in asthma action plans. And that's just not accessible to everybody. It's also not accessible to children in some cases. And as I mentioned, people as young as 9 are in charge of their own asthma, so it's important that they have a tool that they can refer to effectively and by themselves. Also, sometimes in asthma, you're in an emergency situation, so a tool needs to be as simple as possible to provide kind of instant reassurance and guidance. The research in relation to the use of visual health communication tools suggests that they can effectively improve comprehension, satisfaction with information, self-management and engagement between a person living with a condition and a healthcare provider. So some potential benefits in terms of replacing words in these tools with images, and that might go some way to dealing with some of the accessibility and usability barriers to the rolling out of asthma action plans. It's also important, as I kind of touched on already, in a paediatric and family context, but also in terms of the ability to use them in kind of busy clinical practice. And we'll touch more as we're going on in terms of kind of how we did that in this study. So as I said, this was a 2-phase study. The first phase was about engaging in a qualitative study with people living with asthma, children, their parents, and healthcare providers, specialists, and kind of more general practitioners who would see people with asthma a lot, to kind of translate traditional written asthma action plans and the messages that they're trying to get across into a picture version. So this is an example of one of the prototypes that was developed as a result of this study. We then worked with a health technology company called BeHealth Solutions to translate that prototype into a piece of software that could be used by a healthcare provider to generate something like this that's in front of you. So the piece of software is very, very simple. It's literally a series of drop-down boxes arranged according to the green, yellow and red zones that a healthcare provider can answer questions and choose kind of the medication and the dose and the strength and the timing and all that type of thing to be able to produce a pictorial asthma action plan that is personalised and as kind of simple or complicated as it needs to be. So you can see on the left the avatar of a child, and this child can be different racial and ethnic backgrounds as well as male or female. The swimming person here can be other sports as well. And this is supposed to be a doctor in the telephone, and that can also be a man. So we took the piece of software into a pilot study, which is kind of a practice to see if it's worth doing a larger study. This pilot trial was a randomized control trial, so we were randomly placing our participants into one group or another, and in this case it was a written or a pictorial asthma action plan group. What we were interested in seeing is there any potential kind of efficacy associated with a pictorial asthma action plan over a written asthma action plan, and how acceptable and feasible is the intervention. So this was conducted in 3 West Virginia clinics. As I said, we had 2 groups, pictorial and written asthma action plan groups. We collected data at baseline, 1, 3 and 6 month follow-up. Our participants were aged 8 to 17. They were living with persistent asthma. They had been prescribed a controller inhaler, so inhaler to use every day, and had never received an asthma action plan before. The outcomes we were interested in, our quantitative outcomes, were asthma control, measured using the asthma control test, adherence to the controller inhaler by placing a sensor on top of the inhaler so we could objectively measure use of the inhaler every day, lung function measured using spirometry, asthma action plan knowledge, and asthma action plan satisfaction. We were also interested in the feasibility and acceptability of the intervention, as well as the kind of study procedures, and we assessed those mainly qualitatively. And I'm going to focus today on the qualitative data because I think it's kind of most interesting in this context because it helped us to learn a lot about the implementation of asthma action plans in clinical practice as well as day-to-day for families, and also the quantitative findings are not written up yet. Okay, thank you. So these are an overview of the qualitative findings, and I'll go through each of them, or each of the columns very quickly. We recruited 45 families, and about half of those, some member of the family or a child took part in an interview. So the data is from that kind of subgroup of the 45 family sample. In terms of acceptability, and that had to do with the fit of the intervention with clinical and daily asthma management needs. People really liked their asthma action plan and felt that it provided a lot of needed knowledge and reassurance. So, for example, one mother said, "I didn't know what to do in an emergency situation, so I feel a lot better now with the plan." However, even though they liked it, actual use on a daily basis was probably not really happening. So one child said, "I haven't had an emergency, but we would do what it says on the paper." In terms of feasibility, and this was more in relation to the study, we mostly got feedback from the healthcare providers in terms of things like recruitment. But a really interesting thing that we identified was in terms of the priorities of healthcare providers and families, so that we can ensure that future kind of asthma action plan self-management support related interventions can tap into their priorities in order to maximise feasibility. So healthcare providers were really strong about the fact that asthma action plans had to occur within a larger kind of education context. That for parents, they mostly wanted to see their children being independent in their asthma management, and for children, they wanted to minimise the impact of asthma on their lives. So really important for future intervention design to make sure we're tapping into those things. There were some indications of how this asthma action plan intervention may be effective in a larger study. So elements of the study itself seem to be influencing behaviour. So the sensor on top of the inhaler made children, according to their own kind of report in the qualitative piece, more aware of their inhaler and more likely to remember to take their inhaler. So another kind of interesting component to keep in mind for the future study. But also we got a lot of feedback that this was the first time that the children themselves had ever been targeted with asthma education, and that they really appreciated and had an impact on how they felt about their asthma and its management. So overall, we learned a lot. I think some of it is really important for moving forward with asthma support programs. Things like if an asthma action plan is supposed to be useful every day, how do we support that? That asthma action plans must be part of a larger self-management support approach. It by itself is not enough, but any asthma action plan does seem to be better than none, but pictorial asthma action plans may be preferred. And a really key piece is how to make this as easy as possible for providers. So just before I finish up, from a health psychology perspective, we approach problems by thinking about the potential barriers and facilitators to a particular behaviour. So if doing a little bit more using of asthma action plans might be important or useful for your own practice, you might want to consider this model, this capability, opportunity, motivation model, to think about your use of asthma action plans in your practice. Think about if any of these potential barriers ring a bell with you, and which of these, if any, you might be able to do something about, to consider doing something differently if that's relevant for you in your asthma management. So what might need to shift here for you to use asthma action plans more? Maybe having access to a colour printer is a barrier, very practical barrier, or maybe your belief in the effectiveness of asthma action plans is a barrier, and what maybe can you do about those things? There is such a wealth of information out there. The HSE asthma section of its website and the Asthma Society of Ireland website, as well as an e-learning portal there, if this is something that you're interested in learning more about. And please contact me if you have any questions.
Thank you, Lisa. We just stop recording. So I'm just going to open the chat there. So if you have any questions for Lisa, or any comments on how you use